West Nile TV, lighting up the region. West Nile TV, lighting up the region.
Hello and good afternoon, our dear viewers of West Nile TV. Yet with us today we have a special broadcast brought to you by UCMB and GLRA. And as we head in front, we shall get to know what UCMB and GLRA mean. And today we have a panel of 3 people and shall later be joined by 1 person. We have the DHO, District Health Officer Zombo. We have a technical advisor, GLRA, regarding TB, and also we have the TB advisor from UCMB, and we shall later be joined by the community advisor from UCMB and GLRA. And our topical discussion today is going to relate about the community engagement towards the fight against TB in West Nile. And specifically, we are in Zombo. And those who always watch the Dr. Show, we have ever had an episode regarding TB, so it will be like a recap for you. Then those who it's your first time, it will be also enable you to get to know what TB is. Before we get into this topical discussion, let our panelists first introduce themselves. I will begin from my near right. You can introduce yourself, sir, to the viewers of West Nile TV.
Thank you so much, moderator. My name is Dr. Bramale Mark, acting District Health Officer of Zombo. I thank you, viewer. Be ready to listen from us. Thank you.
All right, thank you. The next person.
Thank you very much, our viewers. Good afternoon. I am Louis Ochen. I work with Uganda Catholic Medical Bureau, shortly termed as UCMB, which is the technical arm of providing health services in the Catholic Church. Thank you very much for joining us, and we hope to have a good discussion with you.
All right, thank you. Then the far right.
Thank you. Good afternoon. My name is Lisa Gerwin Adima. I'm working as a technical advisor for German Leprosy and Tuberculosis Relief Association, one of the oldest organizations in Uganda. We came to Uganda first time in 1961, and initially with leprosy. Later on we took TB on board and other neglected tropical diseases. And and in the course of the session we will share more with you.
All right, thank you very much. So in brief, Dr. Mark, Mr. Louis, and Mrs. Lisa. Hope the viewers you have gotten to know. And our topical discussion, please keep note, is going to regard about TB. And as our panelists have told us that TB has been a neglected tropical disease. We pick on Mr. Louis. I forward this question to you. What is TB? Because the viewer outside there, maybe those who have never followed our health episodes, may not know what TB is. Let's pick on what's TB.
Thank you very much, moderator, and thank you for asking that very important question. Most people will always call it TB, but it is tuberculosis in full, an ancient disease, very old. It is dated back to about 4,000 years ago. And it's a disease which majorly affects the lungs, but can also affect other parts of the body. It can affect the brain, the bones, the abdomen, and any other part of the body. But very important to note is that TB is caused by a germ, a bacteria, which is called Mycobacterium tuberculosis. So to wrap it up, it's an old disease which majorly affects the lungs, and everyone is at risk of getting. Just to add a little is that including even Nelson Mandela the famous suffered from TB and cured. Thank you.
Okay, thank you to Mr. Luis. Hope the viewers of SNTV have gotten to know TB, and he has told us it's a disease of the lungs. So, and me, what I know, the lungs, like it's the fuel, part of the fuel which runs the body. So in case you can't take in air, your life will be at stake. So they are going to take us on how we can also know in the community whether we have TB or not. Again, I come back to Mr. Luis. A viewer outside there already, could have scared him off or her off by telling us it's the disease of the lungs. Even the famous Nelson Mandela suffered from it. What could be the presentations someone in the community could have for them to know that to get a question mark whether they could be having TB?
Thank you, moderator, and our viewers. The signs and symptoms of TB are always, I could say they're very clear, and once we get to grasp them, we can actually get to know in our communities who could be having signs and needs to be reviewed. Being a disease that affects the lungs, we all know that the lungs, most times when it's affected, it will present with a cough. So cough is the main sign of TB, and most times this cough is for 2 weeks or more. And still adding to that, we see that persons who have TB also have night sweats, not this normal night sweats. This is drenching night sweats where other people are not sweating that much at night and they are not wetting their beddings, but a TB patient will have those night sweats. Then there's weight loss, and we always want to qualify that weight loss to be unexplained. Some people lose weight willingly, but this is weight loss which you have no explanation for. So it's one of the key signs of TB. You see in adults, someone, the clothes are no longer fitting them. In children, they are not gaining their weight normally like the way we expect. That is one of the key signs. We also have loss of appetite. It's common among persons with TB, and still it is unexplained. Some people lose appetite when they are planned to, but this is unexplained loss of appetite. And even fevers which are persistent for 2 weeks or more, it's also one of the key signs of TB. So those are the classical signs of TB one should look out for, and when they are present, they should seek out for medical attention.
Okay, thank you very much, Mr. Luis, and also the viewers of Western TV. Hope you have gotten to know some of the clinical signs and symptoms you could be having in the community, which you could be having for you to know that you either have this tuberculosis, or which we, in layman's language, we are calling TB, though still it remains medical. Again, before I leave you, Mr. Luis, I need to know, because you have told us it presents with this weight loss, to go further to ask. Sometimes people who have HIV also, they have the same signs and symptoms. How can someone differentiate that in case they have maybe to know it could either be HIV or it could either be tuberculosis? How can the viewer differentiate that?
The differentiation for HIV and TB, we can only do that through having a test to confirm what the problem is. But like you have mentioned, sometimes HIV predisposes or weakens someone's immunity, what we call their scaries, which fight these other diseases. And TB is one of those diseases which takes that opportunity of when there's scurry in the body, the immune system is low, and then they ride on that opportunity. So you may find there are instances where someone who has HIV is having TB because they are at substantially higher risk of getting TB. But that's not all. There are other things also which can make someone's immunity get low. So it doesn't mean that having TB automatically you have HIV. Actually, we are seeing a number of TB patients are HIV negative because they have also had other factors which have lowered their immunity or put them at risk of getting TB. So to get to know whether the fever, the weight loss is due to HIV or TB, it's only through testing. And when you have signs of TB, you are tested for both TB and HIV as well. And when you also have signs, when you are tested for HIV, you are also screened for TB. So these move hand in hand. Thank you.
Okay, thank you very much, Mr. Luis. Indeed, he has explained it for us because actually people in the community, they are puzzled with those two. However, you have told us that they move hand in hand with their brother and sister, but one can predispose someone to get. Maybe you have said HIV can weaken the immunity to predispose someone to get TB. I'm glad for that clarification, and also the viewers hope they have gotten to differentiate the two. Then I move to Madam Lisa. How can someone in the community acquire TB? How can TB be transmitted?
Yeah, thank you. It's a very good and a very important question. As Louis has explained already, TB is a disease primarily of the lungs, and that means whenever we choke, whenever we sneeze, whenever we cough, we are releasing droplets, and these droplets are hanging for quite some time in the air. And when we are now together and we talk, we laugh, we sneeze, these droplets can be inhaled now by my neighbor or by the person with whom I'm living together in the household. That's one of the reasons also why when we have identified a TB patient, we as health workers, we always make attempts to go to the households to screen the other household members as well, because of the risk of droplets hanging in the air and they can be inhaled by others. And in that way it can also spread very easily in the community.
Okay. All right. Thank you very much, Madam Lisa. Hope the viewers have gotten to know what she has told us and how you can acquire TB. She said through aerosols. A viewer may not know aerosols, but let me say like they're droplets.
Yeah.
In case someone coughs, those droplets, they may inhale them in. So meaning almost the transmission is like COVID. We have been in COVID. However, we shall get to know how the viewers outside there can prevent or keep themselves safe from acquiring this TB. Then I still stick to you. How can TB be diagnosed?
Yeah, thank you, Mr. Sunday. Yeah, TB can be diagnosed in the laboratory in the first place because I have these droplets, this bacteria now in my lungs, and if I produce now my sputum, that means my cough is productive, and I spit into a container which will be brought to the lab, and the laboratory has different methods to look now for this particular TB bacterium. And one is, of course, the good old microscopy, a very old method, not very sensitive, but still very reliable, we look for the so-called bacteria, which we call acid-fast bacilli, and with some special staining methods, and most of our laboratories, if not all, in Western can perform these methods. But since 2010, we also have specialized techniques, which are also very very much distributed also here in West Nile, which are molecular biology techniques where we have a simplified polymerase chain reactions. That means we look for the DNA, we amplify it, and then the machine can tell us, yes, there is TB. Much more sensitive than the microscopy, but that's one of the easiest way to diagnose TB. However, for some people, like for instance, Louis explained, who is at risk also to get HIV or vice versa, where patients do not have a productive cough, we do X-rays. And the X-rays methodology, the techniques have also improved. Like for instance, we have now digital X-rays, and Louis is working in some of the districts in West Nile with a particular X-ray, which is mobile. That means he can pack it in a rucksack and then he moves out to the various communities to look for the TB, for the changes in the lungs, which are visible on the X-ray.
Okay. All right. Thank you very much, Madam Lisa. Another question for you. Are these services still open, or where can the viewers of West Nile TV access these services to diagnose or to test themselves whether they have TB? Do you have specific points maybe in the region, since you are based in West Nile, where you could direct these people to seek and get treatment or maybe diagnosis or tests?
Basically, and Dr. Mark will correct me if I say no something wrong, basically TB services are available in every health unit. The capacity building of NTLP with sometimes support from partners has gone so far that every health center 3 has a capacity to diagnose TB. Not every health center 3 has a possibility of having a gene expert, this molecular biology technique available, but they all have a microscope and they can start from there. So if you refer now to the availability of the digital X-ray with which Louis is working, those are also open to particularly to 3 districts in West Nile, but they go for outreaches, and these outreaches are announced via the radio, so people who pay attention to radio calls can also access the digital X-ray. But in overall, NTLP, our National TB Tuberculosis Program, offers TB tests throughout the country in all health facilities.
Okay, thank you very much, Madam Lisa. Hope the viewers, you have gotten to know where you can access these services for TB testing. She has told us even they have capacity build up even in health center 3s. So if you're a viewer there, health center 3s, I believe every sub-county there is a health center 3. So the viewers, you can reach out to those health center 3s in case you have any of the signs or symptoms Mr. Ruiz told us before we headed or went on with the session. Also now we go to our next guest, Dr. Mark.
Yes.
Specifically, this program is in Zombo. What is the picture, how is the picture like with TB prevalence in Zombo, and what are some of the factors which are facilitating maybe to have a high capacity or number or high prevalence of TB patients in Zombo, or to have a lower number of TB patients in Zombo? What are some of those factors which are leading to this prevalence in Zombo district?
Thank you, moderator. Thank you, viewer. I want to first of all begin by thanking my colleagues, Louis and Lisa, for being able to explain what TB is and whatever they have done so far. Well, for Zombo, to specifically have this program, we came, I would say it is from a long journey, and I would date it back to 2020 when we had an experience of the pandemic of COVID-19, but that did not mean that we were not having TB. But I think it glaringly gave us a picture when Ministry of Health in 2021 did a mapping of the prevalence of TB in the country. Zombo in West Nile was categorized under the red zone, and that meant that we had a higher burden compared to other districts in the West Nile region. To be specific, in 2020-2021 financial year, prevalence rate was up to 413 per 100,000, 413 cases per 100,000. And you know, like as a country, we were in between 200 and 230. So 400 cases per 100,000 was quite a very high figure. What could have caused this? Well, Zombo, I would say, is a district that has been disadvantaged for a number of reasons. One, our poverty level is quite high. When you look at the rating of the West Nile region poverty versus the Karamoja region, I think now even we should be surpassing Karamoja region in terms of poverty. So you know, TB, as it has already been highlighted by my colleague, is a disease that will always affect the people with the low socioeconomic status. And you know, with poverty, you'll have poor housing, you have poor diet, and so many other disadvantages that will lower actually your immunity or facilitate the process of the transmission of that bacteria. Because you know, most of the people of Zombo lives within a hut where about more than 5 people are housed or sleeping under the same roof. And if one person is coughing, then definitely it puts you at a disadvantage. Secondly, is on issues of the border that has also interfered with a number of issues, where 9 out of the 15 sub-counties that we have in the district are bordering DRC, and movements are free, because these are brothers and sisters, can cross and stay the other side, has a garden the other side, and have a sleeping house this side. So that interaction definitely will have an effect. So to say, I want to appreciate Ministry of Health and this team, specifically for the program that is being undertaken that you asked about, because we have seen a journey of improvement in the diagnosis of the disease itself. Thank you.
All right. Thank you very much, Dr. Mark, and who happens to be the DHO Zombo district. He has given us the picture of TB in Zombo, and he has told us many of the leading factors which facilitated this HIV high prevalences of TB in Zombo, the poverty states, and also it being near the border, so there is unrestricted movement. Let's first get into a short commercial break, and we shall be back in the next segment where our panelists will take us through the achievements the team or these organizations, CMB and GLRA, have achieved towards the fight against TB in West Nile. Thank you. Let's get back.
West Nile TV, lighting up the region. West Nile TV, lighting up the region.
Dear viewers, from that short commercial break, and with us today, we had a special broadcast which was brought to you by UCMB, which they told us in the first segment is Uganda Catholic Medical Bureau, and GLRA, which is German Leprosy and TB
Relief Association.
And the main target for our topical discussion today is regarding community engagement towards the fight against TB in West Nile. And they told us why these two organizations came up to fight against TB, because Zombo, well, actually here in Zombo, it was marked red by the Ministry of Health. So that's why they put in efforts to come and fight or curb this high spreading TB in West Nile. And they told us it spread, or the prevalence was high during the COVID-19 pandemic. And so far, I'm going to come back again to Mr. Ruiz. As the organizations UCMB and GLRA, you have come up because you saw Zombo had a red marking due to TB. What so far achievements or successes have the organizations marked towards the fight against TB?
Oh, thank you very much, moderator, for having me back again. I would say UCMB and GLRA partnership and work in West Nile dates some time back, and the fight against TB in West Nile, we could say, has moved across many projects and across many districts in West Nile. But one of the key
West
things
Nile
to note is that
TV,
through the implementation
lighting
of these
up
processes,
the
we
region.
get to appreciate the importance of community structures and how we should engage them to achieve the TB treatment outcomes, number one, and also to identify the TB patients we should be identifying. And over time, we have also had capacity development for health workers. We have conducted trainings, facilitated trainings with support from the National TB Program to see that our health workers are in position to correctly diagnose TB patients and give them treatment which is accurate, as well as to our community wing, the VHTs and the TB survivors. We have survivor groups who work in the community to identify the people. We were talking about the signs previously, and their samples are picked and referred to the facility. And where there are those who have disengaged from treatment, we are seeing that this is a very resourceful group. The community team are actually timely referring them. And over time, we learned that the referrals have increased. Specifically in Zombo, we are seeing that the number of TB patients who are coming from the community actually is almost more than 50% of the TB patients we are identifying. And that's what makes us to see that it's a very good success in engaging this group. And together with GLRA also, we have continued to implement innovative tools like the digital X-ray screening. In Zombo particularly, we have recently partnered with the ministry and National TB Program, who have sent through the TB truck, the TB van, which screens digital X-ray and does the testing. It's a one-stop shop center, a hospital which is on the wheels, where we have done screening. And as you can see from the findings there, we had some screening in May. In the last column, you could see we identified about 36 TB patients just in a period of a week. And the dates there in May show you when we were there and which community we were targeting exactly. You see that there are some communities like we had up to 10 TB patients being identified in one community in a day, which really we see that this is a very big achievement. Additionally, also, these digital X-rays we are implementing in 3 districts in West Nile. They are static, the ones you can carry on your back, and do screening from that point and pick samples in Maracha. We have in Madiokolo, Terego, and Koboko. Maracha actually static. At the hospital we have that machine where we
West
screen
Nile
children, then
TV,
including even
lighting up the
with
region.
support from the BMZ project. I think this and many more, we see that so far the achievements of working together with GLRA, UCMB, and the district local governments and the national TB program. Thank you.
All right. Thank you very much, Mr. Luis. And indeed, you have had a great achievement regarding this track, let me say track of these TB patients, because it's not easy to track down these people up to the grassroots. So that's a very great achievement you have so far achieved. Then I have a question. Often people, when they suffer from
West Nile TV, lighting up the region.
When you meet in the community, you can't suffer from the same disease again. After someone has gotten TB and they have healed, could these people still get back TB? And also, after addressing that question, you give us on ground what at the moment you are doing on ground as UCMB and GLRA towards the fight against TB, to see that we zero it down to here in West Nile region.
Oh, thank you very much. Your point is true, and I agree with you. Getting an episode of TB does not mean you will not get another one. If you continue being exposed, like what we shared previously, Lisa shared with us how it is spread, you can actually get TB. And there are even chances of getting
West Nile TV, lighting up the region.
Drug-resistant form of TB. So once someone has gotten TB, they should take precautions to avoid another episode of tuberculosis coming up. Then to your second question, you wanted to know what are we doing, UCMB, GLRA, and the District of Zombo at the moment. Adding on to what the facilities are doing, we are working together to continue with the capacity development, routine mentorships and support supervision to build the technical capacities of our healthcare workers, including even at health center 1 level. Those are the VHTs. Number 2, we are encouraging, we are trying to create awareness such that our community members get to know that once you have a cough, you have a night sweat, the signs we have talked about, get time and move to the facility. But in the instance they are not in position, our level 1 health facility, the VHTs, have been trained, and we continue to support them to move the samples of these persons to be tested at the what? At the facility. And there are other campaigns like this, the National TB campaign, which happens twice a year. And with support from the district and working together, we also support to see that the community awareness, it's called the CAST campaign, community awareness, sensitization, and treatment, testing and treatment for TB and leprosy and other diseases. So creating awareness in communities, continue to pick samples from the communities, ensuring that at the facility capacity is there to diagnose and treat, and also document the records very well. I think basically, and also as stated before, building on the technology, the innovative technology like digital X-ray for screening for TB.
Okay. All right. Thank you very much, Mr. Luis. Hope the viewers have gotten to know what the team or these two organizations are doing on ground in order to zero down or curb the prevalence of TB, which is high here in Zombo, here in the West Nile region, specifically Zombo. Then our topical discussion is regarding community engagement towards the fight of TB. I welcome you on the panel, Mr. Moses. You can take us through what are some of the roles the community members should do in order to curb down or reduce the spread of TB or the high prevalence of TB to zero it down. What are some of the specific roles the community could do?
Thank you very much, moderator. The community has the most big hand in preventing TB because the TB patients are in the community, and the support from the community will influence the outcome. So the community is very important that we ask them to cooperate and be involved in the TB control program. They have to cause sensitization or awareness raising because when we find that we are strengthening what we are calling the survivors clubs, these are the people who have this experience, they share, they knew how TB came and how TB got cured. So when they are actively involved in the community, right from the planning, implementation, management, and monitoring of the TB activities. So those community structures which we talk about, they are those structures, for instance, what we call social support systems. These social support systems are those important people who can help us in decision making. Then there are those community-owned resource persons. These community-owned resource persons are those persons within the community, identified by the community members, respected and accepted. Then these community structures, we have the cultural leaders. You find a culture which says that TB is a myth, probably a curse, or so if you don't involve this community, which can demystify those misconceptions, it is usually very hard. So we encourage the community because they are the one who can act as supporters when we talk about treatment supporters, to encourage somebody to continue with the treatment for these 6 long months. So the community is very important, and then all the higher institutions, departments and whatever, have community level staff. So we find that like when we talk about the community structure, we run very quickly the VHTs, because without that structure down there, fighting TB would be a losing battle. So that's why it is important for us that we involve the community right from the beginning in the planning and the implementation. And the other aspect of the community is like they rightly tell us that health is made at home and prepared in hospitals. So the disease is in the community, and management it must be in the community. So that's why it's very important that when we are looking at TB management or care, stigma, discrimination, we start with the community. Because the people being stigmatized with TB are not because they are found in the road or the taxi. They are stigmatized within their community. When they are discriminated from their community. When we are looking at what we call social determinants of health, the social determinants of health to TB are not in the hospitals, they're in the community, which the DHO rightly said about poverty, nutrition, housing. So it is really very important to involve the community. Even the preventive measures, which we think that can prevent TB, they must be community initiated. If you are taking children for BCG immunization, it should be community involvement. If you want patients to adhere to treatment, this treatment is found daily from the community, not daily from the facility. So if the community is not willing to help these people to adhere to the treatment, we might be playing a fight, a losing battle. So that's why you have to involve the community directly. Even when we are saying we are doing the contact tracing in the community, it is very important to engage the community to understand what we are meaning by contact tracing, because it can be misinterpreted that when somebody has TB, the whole family is involved. That's why you find that once you have TB, every health worker will come to your house, and that's the way discriminating and stigmatizing. So it is very important for us to involve the community structures.
Okay. All right. Thank you very much, Mr. Moses, for that elaborate discussion on what the community should do in order to curb or fight this TB prevalence in West Nile. Then you talked of a key point there, stigma. What have these two organizations, UCMB and PLRA, done in order to see they curb down the stigma rates? Because I know these people often in the society, they are isolated or downlooked because of TB. Then also, what have these two organizations done in order to remind these people to take their drugs? Because it's a long-term treatment over 6 months. So what have these two organizations done such that these people do not miss out on their doses?
Yeah, these two organizations have put in effort to fight stigma and discrimination up to a level of we want it to be eliminated. We have been conducting stigma elimination trainings to people of different cadres. We had a training of health workers in stigma and discrimination elimination. We had the victim trainings, and when we, of the most recent, we engaged in the district leaders to be involved in stigma fighting. And that's why I find that we had a focus group discussion with district leaders. We had these district teams so that we really find out the knowledge gap in stigma and discrimination. And there are areas where we all agree the same, that there are no laws. If they are there, they are not being implemented. So we went through that one as far as forming what we are calling survivor advocacy groups. So that these people who have endeavored to go through the TB treatment can come up and become peer supporters and help us to the community, to help their colleagues, because they have experienced the stigma. And now we are trying to tell them that stigma can, on one hand, can be prevented by them by accessing their rights as human beings. So these groups of, we have 10 groups, we follow up them and we train them and coach them. How do you lobby and how do you advocate for your rights? So that they can fight for their own rights, because every Ugandan has the right to dignity and self-respect. Then about the adherence treatment, we use these community structures. There are people we call treatment supporters. So through our communities, there are those treatment supporters who are identified by the patient himself, that he agrees and he respects and understands to whom is as a treatment supporter, so that they adhere to the treatment.
Okay. Thank you very much, Mr. Moses, for that elaborate discussion on what the two organizations have done in order to cut down or fight the high prevalences of TB in West Nile. Then I come back to Dr. Mark, the DHO of Zombo District. What are some of the challenges your team and the two organizations have faced towards the fight of TB here in West Nile, specifically Zombo District?
Well, thank you very much, moderator and viewer. To begin with, I'm happy, based on the achievement that these people have talked about, some of these problems are now being addressed. One, initially we had fewer treatment centers. We call them DTUs, Diagnostic and Treatment Units. Why? Because we had more health center 2s than health center 3s. So these are being upgraded to health center 3, so we may have actually more treatment centers than before. Number 2, we were doing what we call sit in the facility and wait for somebody to present with their complaint. And that is the next syndrome of clinicians, not knowing that TB is actually in the community. Number 3 is still about our challenges of the border issues. When we identify these cases of TB, like it has been flashed, the 37, you'll find about 8 of them may be coming from Congo. And when they cross the other side, sometimes we fail to trace them. In turn, because we want to give this treatment consistently for the 6 months or more, so that you are cured. So when you begin getting this treatment intermittently, then it gives us a bit of worry whether you'll get cured or not. So these are basically some of the issues that we have had. But I also want to thank GLRA and UCMB for introducing another higher level treatment center, and that is Nyopea Hospital. They brought for us another gene expert and fluorescent microscope that is doing for us a very good job in trying to analyze this information from data sample being collected from the community. But finally, I think to add on to what the achievement I've mentioned for us, I must tell the viewers that we have made a significant stride in diagnosis and picking up these TB cases. Last year, moderator, Zombo District was rated number 8 out of the best 10 districts in the country in identifying TB. So when I came with that accolade, my chairman was saying, why are you being rated for being the best in a disease? So for me, I'm happy about it, because that means that we're picking the disease and we want to see ourselves Zombo move into a TB-free generation, and that is what we are focusing on. And I want to thank Ministry for that. I thank the team that are giving us the support. Thank you.
All right, thank you very much, Dr. Mark, who is the DHO Zombo district, and indeed being the 8th all over the country, that is an accolade to be celebrated. Then I go back to Mr. Lewis. We are talking about TB. The viewer outside there already is eager to know. You have told us how worrying it is, the signs and symptoms. How can the viewer outside there watching West Nile TV prevent or keep themselves safe from acquiring TB?
Oh, thank you. Actually, that is very important, and it is the point which I would wish our viewers to go home with, because if we are to fight TB, then prevention comes at the forefront. The first way to prevent TB is right from birth, the childhood, the immunization, which prevents the severe forms, because we have talked of severe forms of TB. So we encourage our viewers to take their children for the routine immunization, which the ministry offers free of charge, such that our children get BCG and they are safe from the severe forms of TB. 2, Uganda and in West Nile, most of us are already at risk of TB, and most times you will find that TB is a patient with TB is got in your household or in your neighborhood, and you have been in close contact with that person. Now there is medication which is available at the health facilities, which we should take to clear what we could have inhaled, which is sleeping, waiting for that time when our bodies become weak, the immunity has gone down. So there is medication available, which is called TB preventive treatment for prevention. And when you take that one, you clear what is there, such that even when your immunity goes down, there is nothing. I can assure us, majority of us already have this bacilli, waiting for that time to wake up. Now this treatment is available. Now ministry has introduced a shorter course for 3 months, and you take it once a week. But surprisingly, the people we call contacts, or people who have been exposed to patients with TB, most times are hesitant to take this medication. And once you remain with the bacilli in you, it's just waiting for that time for your immunity to go down, and TB shows up. Another way we can do is through protection. If you rather have a TB patient, then we should see that we are avoiding the close contact, or we are giving them masks. The precautions we took during COVID, we have learned it is through droplets. So we prevent anything, we put barriers which prevent that. Then if you are staying in a room, living in a room, it does not like crowded places with poor ventilation. Our homesteads should have windows which are routinely open, and then there's fresh air, there's air moving across, and having our patients of TB follow the correct etiquettes of coughing. There's measures for coughing, which prevents you from putting these droplets in the air which another person or your neighbor could inhale. I think basically those are some of the prevention approaches we could take as a community to prevent us from getting TB.
All right, thank you very much, Mr. Ruiz, and also the viewers of West Nile TV have gotten to note that on the preventive measures, it's like COVID. So if you put on a face mask, you keep yourself safe and those around you safe from getting this TB. Maybe in just 1 minute, where do you see yourselves in the fight against TB in the next 2 years as UCMB and GLRA?
Together with the district, we all look at the bigger picture, the national picture of ending TB by 2030, and that is the goal which all of us should be looking into. So all our interventions right now with UCMB, GLRA district is geared towards that national picture and the targets which were set by WHO to see that when we reach 2030, TB is no longer a big burden to our communities. It is not making our patients to lose a lot of resources in treatment. I can assure you, before a TB patient is diagnosed, they have lost a lot of resources treating themselves in the routine facilities and even through traditional or other treatment centers. So we want to see that by 2030, people are not going through that. And by 2030, the number of TB patients have reduced, the number of deaths have reduced. So all our interventions, which we mentioned earlier, are geared towards the bigger goal of ending TB by 2030.
All right. Thank you very much, Mr. Luis, and also our esteemed viewers who are with us since the beginning of this special broadcast. And we have almost come to the end of the broadcast, and we believe that the viewers of S9 TV, you have not remained the same. You have gotten to know what TB is and how you can keep yourself safe and the community around you safe. And then further to note, you can reach out in any health center 3 for further diagnosis in case you have any of those signs and symptoms. And a special applause to UCMB and DLRA in the fight towards TB. Thank you. Till we meet again. Thank you very much.
West Nile TV, lighting up the region.